afternoon, everybody. Here with Josh and Brian and the superintendents from New Canaan and New London and the former superintendent from Meriden, Miguel Cordona, because we wanted to talk a little bit about the results of our education surveys. We think about how we can safely reopen our schools in a little over a month. But first, let me give you a quick daily summary. Actually, it's a 3-day summary since Friday. I think of most interest to me at this point is the fact that 207 positive cases out of about 32,000 tests performed. That's about a 0.6%, less than 1% positivity rate. And Josh reminds me, we've now had a 1% or so positivity rate over the last month. So there's, for now, a fair amount of consistency there. And obviously, being able to maintain a low infection rate is key to everything we want to try and do a month from now when it comes to schools, et cetera. One of the ways we're trying to protect ourselves, we're not an island, but as you know, we've worked very hard to limit the number of folks coming into our state from those very highly infected states. I think we're at about 31 states at this point, so it's a lot. Fortunately, none of them are neighbors, so that's very helpful. We have good neighbors. We started moving to the online form, so we captured not just folks flying in from Texas and Arizona and Florida and those other states, but also those who may be driving in. Maybe they catch a flight in LaGuardia Airport, then they're driving up from there. And so the online form allowed us to track and see who's coming into the state and where they'll be staying. And we announced that, I think, on Thursday, and you can see here we've had 5,000 of those forms filled out since Thursday. That's a really good thing. That just tells us that, fortunately, people are voluntarily taking this quarantine very seriously, for which we're most appreciative. A number of calls as well into 211. I asked Josh, where are most of the forms being filled out? And by far, the number one is from folks getting out of Florida and coming up to Connecticut. So some time ago, we always thought about a lot of people leaving Connecticut for Florida. Well, 25% of all the inquiries and forms filled out are folks leaving Florida at this point. I will tell you, just in terms of protecting ourselves, one other thing I just want to highlight for you is we've had some parties, and those parties have carried with them a fair number of infections. A couple down in Fairfield County where we were there today with Brian, involving young people coming in from out of state, and others a party. One involved vaping, and a lot of people sharing that. So we've got to be very careful there, because those are where the flare-ups have come before. And but I'll tell you, the folks who find out who's hosting these parties, people were not very happy with them. So there's a fair amount of accountability just informally done that way. I think finally you can see, this is the sign you see when you land at Bradley Airport. You need to self-quarantine for 14 days, and I think a majority of people are doing that. All right, let's tell you top line what I'm hearing from the schools. I think we did a survey. We heard from about 231 different school districts. Miguel Cordona and his team, based upon a lot of feedback from teachers and parents and some students who have been actively involved. The survey came back, which was quite interesting. The survey found that about 3/4, 76% of students expected to and looking forward to actually going back to school in the fall in person. We can talk about that in a minute, but very important to a lot of the students that I've had a chance to meet with as I've gone around the state. They miss their friends, they need the socialization, and maybe not kids of every generation, but these are looking forward to getting back to school in the classroom. I was a little surprised that 81% of teachers expect to be in the classroom teaching this fall, because I've obviously heard a lot of feedback, a lot of concerns from a number of teachers in terms of public health and such. So we'll see how that sorts out over the course of the next few weeks. Some of the concerns were, about public health from the teachers. And again, I remind people that the state is there to backstop every single one of our school districts when it comes to public health and public safety. We'll be there for the PPE. We'll be there for the masks. We'll be there for the disinfectants. We'll be there to do everything we can to make sure from a public health point of view you're safe. And for those students who don't necessarily feel confident going back into the classroom quite yet and think they'll probably be more likely to telelearn and be learning from home, we have made a big priority. We'll be backstopping all of our superintendents in terms of the technology they need to be able to zoom in and out of that classroom so they continue to learn remotely. As you know, we previously purchased 60,000 laptops through the Connecticut Partnership and the Dalio Foundation, and we've about doubled down on that now by purchasing another 50,000, I think it is, Chromebooks, which we're going to get distributed to those folks who don't think they're ready to go back into the classroom so we can take care of them. And it's of interest to me that if, say, 3/4 of the kids are going to be in the class, 25% aren't, that, of course, leads to more spacing in the classroom as well, which I think is one of the important criteria. You know, the number one criteria for getting back to school safely is the metrics, making sure we keep a very low infection rate. Number two is the mask. That buys us a lot of safety for young people and teachers. Number three is cohorting. And I think we found, and Miguel will speak about this in a minute, cohorting means you stay within your group as much as you can. So if there is an infection, it just infects your class and the such. And that's why we found great interest, almost unanimous, in K through 5 in-person education, easier to cohort, most important years, least likely to be able to distance learn, have them in the classroom. And from there, we're maximizing flexibility for all of our superintendents, right? You got that, Brian? Flexibility. And because we heard from, middle school and then high school, every district has a slightly different way they want to be doing this, trying to emphasize getting kids in the classroom, but only if we could do that very safely. 54%, just a little over half, thought that they'd be taking the bus to school. That was very interesting because we'd like to be able to maintain some spacing in the buses, even with the mask. Some of the financial questions that came back to us from superintendents was, hey, if I have to double down on the number of buses, how do we acquire the buses? How do we pay for the buses? Well, this may be self-resolving itself if we find that either a number of kids, a quarter of the kids don't go to school, maybe another quarter prefer to getting to school a different way, not on a bus, and all of a sudden you've got a little additional space there. And finally, as you can see, many people are still unsure, say, 20 to 30%, and times will change. But I just want everybody to know that as we talk about education, talk about how important it is to get these kids back in the classroom, public health is going to be our priority number 1, 2, and 3 for teachers, superintendents, and all the powers that are there. And finally, before I introduce Miguel, who can introduce our superintendents, here's just a short. I've gone to a fair number of the local districts. Obviously, I was in Fairfield County today, where Brian was, New London just the other day. I was in Ansonia, West Haven. Two of the kids from West Haven, they really emphasized that they miss the classroom, want to get back in the classroom. Teachers are doing what they can with Zoom, but the interaction, I think, is what makes the classroom so special. And I've heard that from teachers, I've heard that from students, and I think you'll hear that from our superintendents as well. Miguel, you want to kick things off?
Sure, thank you, Governor. I'll be brief because I know it's really important that people hear from folks that are in the districts, coming up with plans with teams. But before I do that, I want to take a moment to thank the districts for their work over the last several weeks, developing plans, well thought out plans, 231 plans we received as of Saturday afternoon, thanks to the hard work of everyone. And that includes principals, teachers, parents who are on those teams to develop these plans. So thank you for the work you've done. Currently, we are reviewing, as I speak, we are reviewing plans. We have a team of 10 here assembled at the agency, led by Chief of Strategic Partnerships, Keith Norton. He's doing that work. And, it's important to note that these plans not only talk about technical changes, whether we're talking about cohorting or distancing, physical distancing, but it's also adaptive shifts. how we're rethinking education now, because we know this is not going to happen overnight. These changes are not going to fix themselves overnight, that we have to shift the thinking and the belief system around public education. I said it before, this is a public education emergency, and we're going to step up to make sure that we're meeting the needs of our learners, getting them in the classroom, because that's where they learn best. We know distance learning doesn't make up for in-classroom learning, but it's critically important that you hear that health and safety will trump whatever decisions are made. We know that we have to make sure that we're thinking about health and safety. We also have to communicate that these plans are fluid, that just because it was turned in Friday doesn't mean that that's the plan that's going to start on day one. It's really important that the plans evolve with our learning of what the data is, but also how to promote health and safety. So I just want to reiterate, the goals are to get our students in our schools. We know that students with special needs, students that are English learners, students that have been disengaged in distance learning are more likely to suffer if we don't get our students back in schools, but we have to do it with health and safety first. I want to introduce Dr. Lutzy from New Canaan, superintendent, and Superintendent Cynthia Ritchie from New London, who worked really hard. And they're going to talk a little bit more about their specific plans and their thinking moving forward. So I'll turn it over to either one of you who would like to speak first.
Sure. I'm happy to speak first on behalf of New London. First, thank you so much, Governor Lamont and Commissioner Cardona, for all of your support. This has truly been a team effort, and I can say that I think the adults learned just equally as much as students do day to day, from school closure all the way to our reopening that occurred this summer for our partial summer school, and as we made our plans and submitted them to you on Friday. Our plan really focuses on core beliefs that are safety, equity, flexibility, collaboration, and excellence in programming. And our goal was to make a plan that could be fluid back and forth. So we color-coded our school reopening plans to be green, which means full in-person, come back to school opening, yellow, which is signaling our hybrid model, which is a 50% capacity, and red, which means we are back to distance learning because it is not safe for everyone to come back into the building. And throughout that plan, we really focused on improving instruction so that instruction can be fluid throughout. So we want students to have a top education, whether they have to learn at home or whether they are in front of a teacher. And we don't want parents to stress about having to fill a void if they have to make a decision for a specific health need, for example. So we have spent a lot of time digging deep into instructional practice and making improvements for that. And you can just imagine that comes with not only training for students, but we have a robust plan for training for staff now. It's our hope that instruction in the classroom could go fluid from being there one day, and then if we have to close the next day, you still know the assignments, you still know how to use your technology, you still know where to access the standards and the assessments, and parents are well informed of the units of instruction that we are trying to deliver. Staff have been a huge part of this, and our survey data is very much aligned with the state's overall data, and those numbers tell a lot. People want good education for their students, but everybody wants everyone to be safe, and we share in those goals. And therefore, we hope our comprehensive plans that offer this green, yellow, and red opportunity and to do education differently in some new environments will really make a difference, and we can get our students back in school. We really miss them. Over the next couple of weeks, we're going to be recording some videos to actually show parents the day in a life of what school may look like, or what your teacher may look like with a mask, to help alleviate some of the maybe fears of how is school going to look, and get students used to the new way of educating. I will say so far our summer school program, that is a small program but it's in person, has worked very well. And it's so great to see life in our buildings again, of staff and of students coming in. So I am excited about what the future has to bring.
Great. Well, I will be glad to go from there. Thank you, Governor Lamont. Thank you, Commissioner Cardona. I'm very happy to be here with you today. And Governor Lamont, thank you for traveling to New Canaan and meeting with us this morning. It was a wonderful conversation, I think very lively. You can tell a room full of very dedicated, passionate superintendent and educational leaders, and we're all grateful for that and for all that you're both doing and everyone around the state is doing. We've been hard at work at schools across the state since the moment we closed, trying to figure out how can we get our kids back in schools. And I can tell you, nobody wants students back in schools more than our educators. We miss them. This is what we do. We've dedicated our lives to helping students and to helping them to grow and to learn. And we are focused every day on figuring out how to do that and how to do it safely. We all know that it's the cumulative results of our collective efforts that'll determine our metrics. And so we're focused on implementing the mitigation strategies that you outlined in the document, in the reopened document, and trying to figure out how to do that well and safely and do it in an educational environment. For instance, we are cohorting our elementary students. We're looking at keeping those classes together throughout the course of the day. We're doing the same in our middle school, although it's not a class at a time, it's more of a grade level team. But Governor Lamont, you mentioned flexibility. It's very difficult to cohort at the high school for a variety of reasons, including just the nature of adolescents and teenage students and our programming things. So some flexibility there will be a wonderful boon to us in our planning, trying to figure out how best to do this work. We're designing opportunities for our students for mask breaks. We recognize that is a significant mitigation strategy, and we need to incorporate masks into our day. But how do we make that work with kids? Superintendent Ritchie mentioned before the summer program. We've had a very successful summer program going as well. It's small scale, but we found that our students are comfortable wearing the masks and they're able to keep them on for a long period of time, which is wonderful. We still need to build in those breaks, but also thinking that some of the angst around mask wearing is probably adult-centered, and our kids are really flexible and adaptable and resilient, and we've seen that throughout the summer. Essentially, with social distancing, we're working to take spaces that were designed for collaborative work and figure out how to set them up to be distanced. And that's been a challenge, but we're emptying furniture out of classrooms. We're figuring out how can we try to stay at a reasonable distance from each other, with our students, with our teachers in the front, and yet still have interactive type activities. Because schools these days are not sit and get. They're active, engaged learning environments. And so we want to make sure that level of engagement continues regardless of sort of the modality and the furniture setup. So we're working hard to figure that out too. How do we continue to deliver world-class educations to our kids and do it in this new venue? One of the ways we're doing that also is looking at outdoor spaces where we can. Whether it's tents or courtyards, putting up shades, identifying places students can go, making sure the technology is robust enough to support that work, and allowing classes and students to go outside, get some fresh air. We know that that's better. At least that's what the health department is telling us. For our students who are home, whether it's by choice through remote learning, or we're also thinking there may be students who aren't feeling well, and we're encouraging anyone not feeling well to stay home. That's an important mitigation strategy as well. And we may have others who, because of their own circumstances, have to quarantine for any reason. So we're developing a robust live streaming system that will continue to deliver the education folks know and expect in our classrooms, but also providing it to students who log in from home. There's a lot of work to do around that, and our curriculum program has been working on that all summer long. But in order to train for what we're going to see in the fall when students return, we're bringing teachers back a little bit early for a full 5 days worth of training. And then we're looking at an onboarding program for our students when we begin as well, because school is going to be different. They're going to be asked to do things they haven't been asked to do before. Instead of traveling to some classes at the elementary, the classes will travel to them, things like that. So we need some time to help them understand how that works. And we're looking to gradually do that in the beginning, and then on the 5th day, go to our full model, whatever that may be. Certainly, we've developed the models around different levels of community spread, and we're continuing to do that work and to further refine those models. But all in all, these are immense challenges, and as always, as we work through all of what we are single-mindedly focused on doing the right thing for our kids, for our parents, for our community, for our staff, making sure that whatever we do, we're guided by the health and safety of all members of our community, and are grateful for the partnerships that we have locally, regionally, statewide. So thank you.
Well, thank you, Brian. Thank you, Cynthia. Please stick around. You get some questions from the feisty Connecticut Press Corps. Max, over to you.
News 8.
Good afternoon, everyone. Governor, before I ask you and the Commissioner questions about the reopening, if I just may ask you about the news out of Springfield about Bay State Medical and the outbreak there. Do you know at this time if any of the people affected are from Connecticut?
Do you know that?
No, we just recently heard news about that outbreak at Bay State Medical. Myself, Josh Jabal, and Commissioner DJ Gifford are looking to obtain more information on that. But yeah, that news just came to our attention right before this press conference.
Okay, and Governor and Commissioner Cardona, there has been, I mean, with the positive, the low infection rate, that would seem to suggest the return of kids into the classrooms. There is some talk around about a plan or the plan to be maybe announced on Thursday, but I would think that because this is so fluid, would you both agree that you need to wait as long as possible before announcing exactly what the plan will look like?
Yeah, it certainly won't be Thursday, and I think you're absolutely right. We ought to spend a little more time. We're getting really good feedback from teachers and superintendents, as you can tell, and we're going to know a lot more about the metrics. As you know, as we've said many times, we're only going forward with Plan A or B, full or hybrid, subject to our being able to maintain a low infection rate, public health first. Yeah. And we won't have that for sure, but try and give schools at least a 2-week notice. Isn't that about right, Miguel?
Yeah, that's right, Governor. We know that the health data will drive this. We're doing well in Connecticut, and I'm glad to see that. But we're also making sure that we continue to build those plans so that we can move back and forth as needed.
Fox 61.
Hello, a quick question before I get to my education questions as well. There have been a lot of complaints lately about the electric rates in Connecticut skyrocketing over the past month. A lot of people are now signing petitions online trying to get those rates down because in an already difficult time they're seeing these higher rates now. Governor, do you have any response to those people and those electric rates?
Well, my understanding is the rates haven't gone up yet, but the bills maybe went up because many more people are at home. It's been very hot. Air conditioning is on. So my hunch is bills have gone up. We did just get indications that there'll be about a 4% electric rate increase instituted by Eversource, I think it is, in the next cycle. About half of that is related to transmission. That's dictated by the federal government, and that's universal around the whole country, I think.
Okay. And my other question is about education, and maybe this could be for the commissioner or even the superintendent there in New Canaan. We're hearing from a lot of realtors that people are moving into Connecticut because of the way that we've handled the COVID-19 pandemic. A lot of those people coming into Connecticut because they want their children in Connecticut schools, especially in Fairfield County. How do we address, one, that influx of new students coming in, and two, what it's going to cost to educate them?
So I feel Dr. Lutzy could elaborate if you'd like, but we're noticing that because Connecticut is doing well, people are looking at Connecticut. We want to make sure that the same health and safety standards that we have for the students that we know about now are kept moving forward. And I think that's critically important to hear first. And we also know that many of our districts are very transient. So we anticipate that in some districts, people are going to be moving from one part of the town to the other, and we have to account for that. And also throughout the state of Connecticut, there are several communities in Connecticut that have a very high transient rate. So we just have to be prepared to accept students, to welcome them, but also to make sure that we're maintaining those same health and safety standards that should drive every part of our plan. Brian, I don't know if you want to add to that.
I can just add, just locally here, we are seeing enrollment increases across the board. In the summer, we generally meet once a week to take a look at our enrollment to be sure that our staffing is appropriate. Now we're meeting every couple of days to take a look at it because of the unknown, as we're figuring this all out. But we are seeing some increase, and so we're adjusting our staffing accordingly. We've had to bring on board a few new staff members in the elementary level in the last couple of days, and we'll keep watching it and keeping an eye on it because the class sizes are so important always, and even more important now. So we're keeping a close eye on it.
NBC Connecticut.
Hi, Governor. Matt Olmston with NBC Connecticut. Before I just quickly ask about education, just wanted to follow up in terms of the Eversource increases that we're seeing with the electric bills. Some people have raised concerns, including Senator Lesser, about the Millstone power plant agreement and if that is also helping to drive some of the increase we're seeing. And just want to see what your reaction was to that point.
Yeah, that is a little bit of the increase as well. You maybe remember that a year and a half ago, first thing I was confronted as governor was the fact that Millstone had already begun negotiating with the prior administration, and it looked like they were considering closing down the Millstone plant. And what we wanted to do was at least buy enough time with Millstone so we could invest in wind power so that over a period of 10 to 12 years we could make that transition. But you're absolutely right. The Millstone power is an aging plant. There was a small increase in their electric generation fees to us and to Eversource, and that is part of the increase.
And in terms of education, I know some schools, based on the current situation with the virus, are leaning to a hybrid model, including New Haven. Are you and the commissioner still hoping for a full-time return to school?
I'll start on that. I mean, we're hearing a mix of things from different superintendents, which is the way it should be, because every situation is a little different. Some of our cities already have a little more crowded schools. Maybe there's some of that in New Haven. I've certainly heard that in Danbury as well, where they think they can't safely get back on a full-time basis, more inclined towards the hybrid model, especially in the middle and the upper school. I think for many of the other school districts, they feel more comfortable getting back on a full-time basis, at least for the lower grades early on.
Sure, and if I can add to that, the expectation was always you develop 3 plans because there's going to be fluidity through it, depending on our health numbers and the infection numbers. And we do want all students to have an opportunity to go to school. So even if you start with a hybrid, because there are issues, the plan is always to continue to aim for having all students in school. We're recognizing, we're hearing from districts that in some places it's very difficult to get the initial plan at the high school level with everyone in. But we're going to aim for that, and we're going to continue to support districts to do that. With that said, as the governor mentioned, it may be that some districts at the high school level and maybe the middle school level are beginning with a hybrid and then working toward a full plan. We also set up a Reopen Schools support team that is available to meet with districts to help them work toward those goals of getting students in.
And will it be up to the districts which model to choose?
So at this point, we're recognizing that the districts have to feel comfortable with the plans that they have to ensure health and safety. So ultimately, once we're closer to the school year starting and we know where the health data is, districts will have to feel comfortable with either the full in-person at the high school or a hybrid. They will be deciding that.
Great,
Channel 3 Eyewitness News.
Good afternoon, Patricia Del Rio here from Channel 3. I have 2 questions for Commissioner Cardona. We get a lot of questions from concerned parents about back to school, and one of the biggest is questioning the cohort model, what exactly it means, particularly on the K-5 level. When you talk about the students being with their core teacher in order to reduce the risk of infection. But these children do have what are called specials, foreign language or art or music and different things. And in theory, those teachers are interacting with all of the students in the grade. So how do those 2 things reconcile?
Thank you for the question. That's a great question. Cohorts are intended to reduce risk, as you said, and it's intended to support our efforts to do any contact tracing if needed. So while there is still interaction, it's limited interaction, so the teachers hopefully will be going into the classroom so the students are not unnecessarily transitioning throughout. So it's a risk reduction strategy. It's not a strategy that reduces 100% any risk. And I think I have to share also, these same students outside the school are engaging with others. So it's not that they're totally in a bubble for that day. We're reducing the number of interactions to prevent additional potential transmission and to make it easier if, whether it's from outside of the schoolhouse, it's brought in, we're able to limit the number of students that have exposure to those students. I know Superintendent Ritchie wants to add to that.
I'd like to add to that. It is a great question. Thank you. So in thinking out of the box regarding instruction, we are also looking at resetting curricular units to be units that fall in a session. So what that means is students may have their music teacher for 4 weeks in a row every single day to get through a good chunk of instruction and limit that teacher's transition to see maybe 3 groups a day for longer periods of time instead of seeing the entire school for the week. So that could be a way where you do rotations of about 4 or 5 week sessions, and by the end of the year, students still get all of the instruction that they need in all of the special areas, but we do it in a limited capacity by focusing and going deep instead of wide with a variety of content all at one time.
Thank you. And my second question is, we're also getting a lot of questions from parents about the option not to send your kid to school in the fall if you do have districts going in class, option A or whatever you wish to call it. Parents seem to have a little bit of confusion about whether they have a choice. In other words, if it is decided by the district that the kids are back in school, but the parent chooses that they want the child to distance learn, is the guidance that this is if the child, it's a medical necessity, or is it that parents can simply make this decision and work out something with their district? What is the guidance there?
Sure. That one is very clear. All parents have choice at any point to keep their children home to experience remote learning. So whether the district goes full in-person every day or hybrid at the high school, a parent will always have the choice to keep their children at remote learning, especially to begin the school year. Down the road, when we are past a certain point, it may be decided that that option can be revisited. But at this point, any parent in Connecticut has the right to keep their children home to receive learning from home.
But are these districts prepared to have these simultaneous models, that you have the teachers dealing with the kids who are in class and then these parents who are wishing to have this distance model?
Yes, that's been probably one of the greater challenges that we've heard from districts. We're basically setting up another system of learning that wasn't there before. It's one thing to say you're doing everyone remote. It's another thing to say you're doing remote and in school. But that's something that the governor made very clear, that he expects that parents who would like to keep their children home have that option. And again, credit to these districts in Connecticut who are working and thinking outside of the box. They are providing those opportunities, and we're hoping to support them. Earlier today, we announced a partnership with Columbia University to try to provide better tools for districts to accomplish this, and also part of the strategy for supporting districts and is giving them resources to be able to do this. If either of the superintendents want to speak a little bit more specifically about what you're doing, I welcome that.
Sure. I think, well, as you mentioned, every district is working hard on this. It looks a little bit different as you look across, but there are a lot of similarities as well, because we are looking to design a system that not only works for folks who choose the remote learning option, but also for students who stay home for a variety of other reasons. So for us, we're looking at a robust, we call it live streaming system, where teachers will be teaching live to the students who are in the classroom, but also streaming that classroom out for others who are home so they can come in with a link and a password and security so that they can stay connected to that classroom, connected to their peers and the teacher and the curricular content that we're doing. We're also integrating learning management platforms at all levels, so that helps us with content and with assessment and handing things out, turning them back in, grading things, what have you. So the learning management system and the live streaming system layered together will be able to sort of create one classroom that's both in person and remote simultaneously.
So you're talking about synchronous learning so that the students can be watching a live class. That's the model that's going to be gone with, because when everything was kind of put together in March, and in fairness, schools had very little time to prepare and they were working with already existing online models. But the idea is to encourage this synchronous learning where the students are watching a live class at home rather than watching a video and then uploading a document later type of thing?
So I think a better term may be blended learning, that there will be synchronous pieces to it, but there also will be times where students may be watching a video of a teacher teaching as in like a flipped classroom, not to get jargony on you, but in a different type of environment. But there will be synchronous dimensions to it. For us here in New Canaan, we are expecting students to log in at the same time that their class is meeting. They'll be logging in, they'll be live with their classmates and live with their teachers. And then there may be other assignments and work that they do where they're logging off to work on whatever may be happening there, and then logging back on at a certain time to reconnect with those classes. So it's fluid like everything in the model, and I think as we continue to implement it, we'll learn and it'll improve over time. But some of the guiding principles are to sort of keep our students connected to their classes, to their schools, peers, and teachers, so that if they do opt out at one point and then want to opt back into class, we can do that as smoothly as possible. And again, it still serves those students who are out for short periods of time, given something that occurs, whether it's their own illness or illness of someone in the family.
The Waterbury Republican American.
Thanks. Yeah, I just want to clarify one point. Because the guidelines had always contemplated local or state closure orders. So it's up to the individual school districts, their leadership, to decide when schools open, whether they'll be open fully or hybrid or all remote, correct?
Hi, this is Commissioner. So districts are going to have the opportunity to ultimately decide what plan works for them. We believe right now with the data where we are, elementary schools can go in, and middle and high schools should also be able to get majority of students in. We recognize that ultimately at the high school level, it might be more feasible to start off in a hybrid version, and that's something that districts are going to be able to decide.
But there's not going to be a situation where the state orders schools to open over local objections, over a local decision to keep their schools closed.
So, correct. Ultimately, local boards and districts have to make the decision based on health and safety standards in that district. We're providing guidance around those health metrics. We expected districts to plan for full reopening, and right now that should be the plan. For districts that are working on balancing between hybrid or full reopening, we want to support them. At this point, the data suggests we should be getting kids into school learning in person. And I think that's the direction that districts need to head. And quite frankly, the majority of the districts we speak to are aiming for that, and the majority of parents and educators are wanting that. Obviously, health and safety are the primary factors. They'll continue to be that, but we can't. We must take into account the risks to students and the impact on students and their families when children are not in school, if it's possible to be in school.
And I guess this is a question on the travel advisory for the governor or whoever else. Has there been any instances of people who have refused to fill out the form? I know there was some talk of dispatching teams from the Department of Public Health to Bradley to make sure that folks have filled out those forms.
I haven't heard that. Have you, Josh?
Yeah, we do have a team at Bradley stationed there, and so far they report that travelers coming in have been extremely cooperative, appreciative for the additional information, and no issues at this point, Paul.
Thank you very much.
The Connecticut Mirror.
Hi, Governor. Some of us were under the impression when you were originally talking about the reopening plan that this was going to be the state basically telling school systems, is it option A, B, or C? Was that a misimpression, or did your thinking change over the past few weeks about giving locals the option?
No offense. I think it was a misimpression, though. Obviously, okay. I and Miguel and most of the folks we talked to obviously saw the advantages of classroom learning. Heard definitely in terms of how important it is, especially for the younger grades, to be able to get into the classroom. We heard from Scott Gottlieb, you can't take this 1% infection rate for granted. Maybe we'll only have 2 or 3 months. Let's do it while we can. But that said, Paz, every town, every city's got very different metrics. So as Miguel has said, I think in majority of the cases, the vast majority, will be able to have in classroom, especially for the lower grades. But some situations will be unique, and we got to give them that flexibility.
Governor, will you need to either seek legislation or extend the public health emergency to give the flexibility to the local school systems to do non-traditional education?
Yeah, that's a very good question. I think we'll have to do something in September to make sure we maintain that flexibility through the school year.
So that probably means declaring or extending the public health emergency?
Unless the legislature wants to extend the flexibility item by item, like in this case for the school year.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Governor, you were talking about the Dalios and the 50,000 new Chromebooks. How close are you to being satisfied that some of these inner city kids are going to get some connectivity?
Yeah, they did the 60,000. We're doing the next 50,000, really focused on the results of Miguel's survey to find out who those kids are, where they are that don't think they're going to be going into school, making sure, A, they get a Chromebook, B, they get some instruction on how to get online. And then Nick Simmons is working closely with the Dalios and others in terms of making sure we have internet access and hot Wi-Fi spots for kids to make sure they can get electronic access as well. So we're working on that. Obviously, that takes a little bit of preparation, but I hope we'll be in time for the school year.
And speaking of misimpressions, Governor, the other day at the Bond Commission, you mentioned that the Winchester schools were going to get some money for a big project up there. Did I mishear you, or did you misspeak? Or Winchester is part of Winstead, and I only learned that today.
You know that, Paul? We'll have to get back to you on that, Ken.
I'm surprised that you only realized that Winchester and Winstead are connected to each other.
Well, I only live on Route 8 about 40 minutes away from there, too, so it's deeply disturbing. I know where I am right now, though. Is anybody talking about tracing recoveries, the average recovery time, or numbers along that, or is that just too labor-intensive at this point?
For COVID patients, yeah.
And remdesivir and the such, is that reducing the hospital time?
I know that our hospitals are tracking those average inpatient stays. I don't have data for you on that right now, but we can follow that up.
And finally, Governor, the Senate's taking up that police accountability bill tomorrow. Are you getting in touch with senators and telling them, asking them to approve it? It's probably close up there.
I would approve it. I think it's a good bill. It takes into account transparency and accountability, builds more trust between the police and the local community. I think it's important. I think the House made it a better bill, and I hope the Senate passes it.
Are you going to bring in anybody into your office to talk or give them a ring on the phone and be socially distant and try to help Senator Winfield get that across the finish line?
Let me see if that's necessary. My understanding is it's moving along pretty well.
Thanks, Governor.
News 12 Connecticut.
Hi, Governor. Just one more question about the Eversource increase. Your administration negotiated the Millstone deal, but a lot of Eversource customers are asking us today, why are we forced to pay more to save this Millstone plant? So can you talk about, I guess, what the alternative would mean, what it would mean to rates if Millstone shut down and took its power supply with it?
Yeah, that was not a very good option. This is going back a year and a half. There was a real possibility that they might have pulled the plug on Millstone, as they've done on a number of other nuclear plants. That would have left us forced to buy peak power, probably polluting peak power, out there in the open market at considerable cost. What we wanted to do, working with Katie Dykes, is find a way you can keep having a carbon-free source of power, not relying upon Millstone forever, but at least for the next bridge until we get to the wind power. So I think that was why we made the commitment we did. I think it's a 12-year commitment. Those prices are going to be fixed over that period of time. And I think it gives us a reliable carbon-free source of power for the medium term until we move to wind.
And Governor, I just want to follow up on Ken's question real quick. I know you said that you support the police accountability bill, but you've also expressed a lot of concerns over the stripping individual officers of their immunity section. Any plans to veto that section of the bill if it passes?
No, it's greatly improved. Nobody's having their immunity stripped away. The qualified immunity here in Connecticut now matches what they're doing at the federal government. Qualified immunity is in place for the vast majority of anything a cop could be doing. There's just in case of wanton, reckless, willful wrongs. In that case, there would be some that your immunity would no longer cover at that case. But that's incredibly rare, and already it's not included under the federal waiver.
And in addition,
all right, thanks, Governor.
In addition, I'll just add there's no line item veto for non-appropriation bills.
There you go.
The Hartford Current.
Good afternoon. This is Emily Brindley from the Current. I wanted to ask first about the rising number of cases among young people, teens, and 20-somethings particularly. Can you comment, Governor, on that trend and also explain a bit about how you plan to combat that trend?
Yeah, I have met with a fair number of students. I've certainly talked to superintendents, around the state right now. I want to reach out to parents. We've got to be really strict about this. I look down in Florida, I look down in Arizona, and the governors there say it often started, with young people. Remember, oh my gosh, but don't worry, maybe the 18 to 30-year-olds are getting infected, but it won't impact the hospitals or anything like that because these guys don't have to worry as much. Nonsense. What you found, a month or 2, 6 weeks later in those states is their hospitals are right at capacity again. So it's incredibly risky behavior, not just for yourself, but also for the broader community. As I said before, I think the parents are getting this message loud and clear, and fellow parents are telling those parents loud and clear that this is not going to be acceptable behavior. And, Josh and our team will think about other sanctions that maybe have to be put into place if people continue to be too casual on this.
In addition, we're going to increase our overall communications through our PSAs as well as through social media to this very specific group of individuals as your question prescribed and as the governor answered.
And when you talk about potential sanctions, what type of thing are you talking about there? Can you give a couple examples of things you might be considering?
Yeah, if there's a big party that doesn't meet our basic guidelines, if we find that there's not even an attempt at real social distancing, if people are passing around a Juul vaping product and sharing it from person to person, I think that's really wrongful behavior. I think it's dangerous behavior. In terms of what sanctions we go, let me get back to you on that.
And then also there's obviously a lot of college students in that age group as well, and UConn is relying pretty heavily on testing to open their campuses back in the fall and make sure that students are safe. But right now it's taking still about a week or longer for a lot of people to get their test results back. So do you have a plan to speed up that turnaround time so that when thousands of students go back to campuses, they can get their test results quickly?
Are they going to work with the local?
Yeah, I mean, a lot of the universities and colleges in Connecticut are working on their testing strategies with Connecticut-based laboratories, and we aren't seeing those types of delays in the Connecticut-based labs. So the labs that we've worked with in Connecticut are still turning around their test results in 24 to 48 hours on average. And I know most of the colleges and universities are working with local labs or doing it in-house or have certain setups where we're hoping that won't be an issue, despite some of the national challenges that are well documented at this point with some of the out-of-state labs.
Thank you.
Connecticut Public Media.
Good afternoon. A question about the blended learning. So hypothetically, if a small town has just one student who feels, or their parents feel it's unsafe for them to return to in-person learning, is it the town or the district responsibility to provide that one student, if it is just one, with the ability to complete the coursework for the year?
Yes, that is accurate. We encourage districts to partner too. It might be worthwhile for districts to pool support services and educational opportunities for students so that there's efficiencies. We're set up in Connecticut to have regional support centers that can maybe facilitate some of those conversations between districts. I know districts are collaborating with one another in ways that they never have in the past, and I anticipate that some innovation is going to come out of this, like what you mentioned, to solve some of those issues, and it might improve education moving forward in education in Connecticut moving forward for good.
Thank you.
CT News Junkie.
Thanks, Max. So I wanted to clarify the reopening of schools. Is there a date certain for full reopening, or are we leaving this to the districts?
So the reopening, each district has their own reopening date. As the governor mentioned, there's going to be more information coming out around our health data and where we feel districts should go. But to answer your question, districts will have to make a determination as to what element of the plan, where they feel comfortable with a full reopening. And as I said before, maybe the high school where it's not possible to go full reopening, they'll start with a hybrid. We're going to continue to give information. So while you might get updates, at the end of the day, this has to remain fluid, even while we're in school. And what we're trying to do to make that a little bit better for districts is provide them some guidance on some thresholds. I know after this conversation, Brian is going to be joining a conversation with others to try to come up with some clear thresholds for districts to start having those conversations about how to move from a full to a hybrid and ultimately, if necessary, to a full distance learning model.
But the state won't be mandating this, and the state won't be dictating this. It'll be up to the districts.
Correct.
Okay, thank you. And my other question is for Governor Lamont or Josh. We are still hearing that PPE is short and that hospitals are still not back to where they are with like N95 masks. So what can you tell us about the PPE supply?
The PPE supply seems to be holding steady. Certainly there's still some areas where there's some constraints, but for example, at the state level, we're still on track to achieve our 90-day stockpile, which we've been targeting by the end of July. We may be a little behind on one or two of the specific items, but we've already achieved our 90-day goals in several categories, and we have a number of orders still coming in every day. Certainly there are some categories, though, where there continue to be global challenges. Gowns continues to come up. Medical grade N95s, as you're alluding to, are being controlled by the federal government and have been for months in terms of where they're sourced and distributed, primarily to hospitals and other healthcare settings. The supply chain globally still remains challenged, but as we had hoped, our orders in Connecticut continue to flow in.
And the other question I had is, are urban districts going to be able to do blended learning?
I'm sorry, can you repeat the question?
Are urban districts going to be able to do blended learning?
Yes, I can speak for New London. We definitely are. We are preparing for both blended learning and distance learning. We are planning on having teachers do some live teaching, as was shared before. We're also having teachers wear swivel devices, which are recording microphones around their neck. And as they teach, they're actually recording their lesson on an iPad that swivels with them, so it can record their mini lesson, and then we can house those lessons and post them to families at a later time or at the teacher's special or lunch break, so that we have those opportunities for students to access the teacher at that time. Pending on our numbers, we are also planning on a separate distance learning team to service students who are full-time at home if that's how they start the year. So we are looking at health data, but we're also looking at survey data and the individual needs of our district to make those decisions.
Thank you. Thank you.
The Associated Press.
Sue, it sounds like you may not be there, so let me just say to Cynthia and Brian and Miguel, thank you. This is so incredibly complex. Getting a school opened, in this part of a pandemic, everybody's anxious. It's our kids. What could be more important? And speaking personally, I got to thank each and every one of you and the folks that you're representing. I think you're giving people confidence that in this complex time, you're taking every necessary precaution to keep people safe, including the swivel mic, Cynthia. And I just say broadly, there was a question about people coming back into the schools, and we heard that today, didn't we, Brian? And look, over the last decade or so, we've had sort of a flattish, declining population. Not a good thing. It did mean we had extra capacity in some of our schools, not all of our schools, certainly not in our city schools, but that capacity does give us a little bit more room to breathe, so to speak. And in the meantime, it's not a bad thing that we do have new people coming in, taking a look at the state, and in part because of the incredible quality of you and our great education system. Thanks so much for being here. Take care, everybody.
Thank you very much. Thank you.